Hello everybody, Dr. Yu here with the next video from the Calgary Guide Video Series, Public Health Control Measures in Response to COVID-19. Now at this time, of course, we have the Omicron variant, a new variant of COVID-19 that's spreading around the world, and I thought it would be a good opportunity to remind ourselves of just why our public health measures are the way they are. A lot of COVID and public health has gotten politicized over the last couple years, but really public health measures are what they are because of scientific reasons based on the physiology of viral transmission and also strategies that have been proven to work in containing viral spread. So today, let's go through some of the individual prevention measures, the public health control measures, and the hospital administrative response measures. Let's zoom in one at a time, starting with the infection of somebody with COVID-19. COVID-19, what is it? It's an infectious disease caused by the SARS-CoV-2 virus. And with no public health control measures, what ends up happening is the number of cases skyrockets exponentially up to a point that it exceeds healthcare system capacity. And as a result, healthcare systems are overwhelmed and normal healthcare cannot be done. So the goal of public health control measures is really to prevent this from happening. To do that, they need to understand how the virus replicates. The SARS-CoV-2 virus replicates in infected patients and is released in their respiratory droplets when infected people cough, sneeze, or talk, or even just breathe. As we know now in December 2021, most of the transmission occurs via smaller respiratory droplets called aerosols that contain viral particles and which can remain airborne and suspended in the air. That's really the main reason why, on an individual basis, we ask everybody to wear a high-quality, well-fitting face mask with minimal gaps between mask and face in public and especially indoors, where ventilation typically is poor, and high quality, meaning that the fabric of the mask is able to filter out small particles, such as N95 level fabric. Now, some respiratory particles are larger, and some of them do end up traveling ballistically up to a distance of 2 meters. And that's where the traditional maintained physical distancing of 2 meters from other people comes from. Now, the CDC has claimed that this is rare, but it is still a method of transmission, so we'll talk about it. Once these larger particles containing the virus settles on a surface, the virus remains viable for up to 72 hours, but can be destroyed by soap or ethanol. And that's where the advice for frequently washing hands and cleaning surfaces comes from, especially using soap and water or an ethanol-based hand rub. Soap, of course, disrupts the phospholipid membrane of the virus, and ethanol does the same thing. If the virus contacts the person's mucous membranes, then infection can occur, not just through the fomite pathway, but also through the respiratory droplet and aerosol pathway. Again, there's a growing number of scientists that believe that the aerosol airborne pathway, is the predominant pathway of SARS-CoV-2 spread. But since infection can occur if the virus contacts a patient's mucous membranes, public health has given the recommendation for people to just generally avoid touching their mouth, nose, eyes, and face mask just to prevent themselves from self-inoculation. I did have a patient in my clinic whose only symptom of COVID-19 was conjunctivitis, probably because he touched a surface and then touched his eyes. Of course, to prevent viral infection in the first place, we can get vaccinated against the virus. Vaccination remains one of our most powerful tools in fighting this disease. After the host is infected, the virus has an incubation period of up to 14 days. That means the patient can be asymptomatic while the virus grows and builds up in their bodies. And then after the symptoms start, the patient or the host for the virus is infectious for approximately 10 days after symptom onset. And most of them stop being infectious after 10 days, as long as all symptoms other than the cough have resolved. Now, this is just because some people get a post-viral cough, which may not be a sign that they still have live virus. And that's where we get our guideline, at least here in Canada, for 14-day quarantine for returning travelers and close contacts of COVID patients, and a minimum of 10-day self-isolation for symptomatic patients with COVID-19. I'm aware of different countries having their own different quarantine rules, and I wonder how much of that is evidence-based. So wherever you're watching this video, pop a comment down below about what your country's quarantine or self-isolation laws or guidance measures are. I'd love to hear from you. So that's an account of individual level prevention measures. Now, in terms of population prevention measures, again, we need to go back to the physiology of how the virus replicates and how the virus is transmitted to other people. So the R0 for COVID-19 is a measure of the degree of transmission of this virus. And for the original wild-type strain of the SARS-CoV-2 virus, the R0 was 2 to 2.5. There are reports of Delta, the Delta variant of the SARS-CoV-2 virus, having an R0 between 5 to 8, so much higher transmission rates than the initial wild-type variant. And in comparison, the R0 for influenza is 1.28. Of course, we need to define what R0 is. So R0 is the average number of people that one contagious person will infect when everybody are susceptible to infection. And note that the R0 for COVID-19 increases dramatically in indoor, poorly ventilated, and crowded settings. So what that comes down to, with an R0 being as high as 5 to 8 for the Delta variant, and remember, we don't know what the R0 for Omicron is because data is still being gathered at this time in December 2021, but it essentially means that this virus can spread like wildfire. SARS-CoV-2 is definitely more infectious than the flu, and people infected by SARS-CoV-2 are much more likely to pass the virus on to other people than they are to pass on other viruses. So some infected individuals can rapidly infect large numbers of people. And indeed, SARS-CoV-2 has great potential for triggering mass outbreaks in indoor settings. And that's why these public health control measures are needed. Public health control measures are essentially community, as in out-of-hospital, measures to reduce the number of people infected and hospitalized. Their goals include removing the infection source, breaking the chain of transmission, and protecting unexposed individuals. So with all these goals in mind, let's look at what they do. So of course, they still ask individuals to maintain their individual prevention measures like getting vaccinated, wearing a high-quality, well-fitting face mask, especially indoors, frequently washing their hands. But they also undertake population-wide measures to prevent these massive outbreaks, such as mandatory mask policies, asking everybody to wear their masks, especially indoors, as well as closing borders to travel. Now that's controversial, but it's still done as a public health control measure to buy time, which has been done for the Omicron variant just recently. Both of these measures try to remove the source of infection to prevent the local population from getting infected quickly. There's, of course, the 14-day quarantine rules for returning travelers and self-isolation guidelines that varies depending on your country for symptomatic COVID-19 patients. And then there's other guidance, such as reducing the crowding of indoor settings and reducing the time that people spend indoors, such as closing schools, limiting hospital and long-term care visitation, canceling indoor mass gatherings like weddings. Now, we've seen in Alberta during the Delta wave from August to October 2021 that kids aged 5 to 11 were the biggest group of COVID spreaders amongst the population, which speaks to the importance of closing schools if we really want to limit transmission of the virus. Other measures can include improving indoor ventilation, such as policies regarding opening windows, as well as increased air filtration using HEPA filters and high-grade filters for entire buildings, so that clean air can be recirculated as often as possible throughout the building. Population-wide, there can be increased surveillance and testing for COVID-19, as well as isolating close contacts and those exposed to the virus. All of these are fundamental principles of public health, and they all contribute to breaking the chain of infection. Now, because large numbers of people can be infected, even though COVID seriously afflicts only a small minority of people who are infected, and by seriously afflict, I mean hospitalize or cause death, the fact that large numbers of people have been infected means that there can be an exponential increase in the number of sick or critically ill patients requiring hospital care. We'll talk about hospital care in a second, but first, these critically ill patients fall predominantly amongst those who are elderly and with comorbidities, such as obesity and diabetes, as well as other chronic diseases. And unfortunately, patients with other chronic diseases have increased mortality. And so part of the goal of public health measures is to assess the populations that are at high risk and to protect them with increasing measures, and as well to assess what they're doing, to continuously see if what they're doing is effective or not. That also works to break the chain of infection. Back to the critically sick patients, the acute care, as in the hospital system, is always at risk of becoming overwhelmed by the patient volume. Remember that hospitals exist not only for COVID-19 patients, but normal diseases do not stop happening during pandemics. People still get into car accidents. People still have heart attacks. The volume dealt with by the healthcare system does not decrease. And so part of the goal of public health is to make sure that there's capacity in the acute care system to still look after the other normal diseases during a pandemic, even as the pandemic is raging. So public health will often coordinate with emergency experts and first responders to maintain disaster and emergency management and capacity. Now, because there's a risk of insufficient medical and protective equipment, and again, PPE is necessary to prevent nosocomial viral spread or the spread of the virus within the healthcare system, public health needs to do their homework on what PPE should be used to optimize the response, how to use masks in the most appropriate ways, as well as help develop treatments and vaccines. Now, all of these control measures by public health, if done effectively, will limit viral spread within communities, contributing to the end goal of minimizing not just serious illness and overall death in the population, but also minimize the total number of cases in the population. Back to the critically sick patients, we now look at the hospital administrative responses in order to help these patients cope. Because COVID-19 consists of a viral pneumonia in the critically sick that reduces their ability to breathe, the hospital needs to make sure that ventilators are available and that there are enough ventilators for the critically sick. They also need to make sure that enough hospital beds and staff are available. And so what's been happening is that elective surgeries, so surgeries that do not need to be done within 3 days or less, are all canceled. Unfortunately, elective doesn't mean not serious. Here in Alberta, we have had patients who have cancer and who need brain tumor removal and other such kinds of surgeries canceled to make room for COVID-19 patients. And ICU capacity has been expanded, taking over other beds in other wards not designed for ICU care, so that hospitals can have enough ICU capacity to look after the sick patients. And finally, hospital administrators also need to increase the supply of personal protective equipment, like N95 respirators, gloves, goggles, and gowns, to make sure that healthcare staff and other patients are safe. So the other part of public health measures is to increase the resources for urgent and critical patient care, again with the end goal of limiting the number of cases and minimizing the serious illness and overall death in the population, so that the number of cases over time do not exceed healthcare system capacity. And that is all for our topic today on the public health control measures in response to COVID-19. For more on COVID-19, you can check out my video on the pathophysiology and clinical findings of COVID-19. Again, if you enjoyed this video and you learned something new, please give this video a like, and that helps other people find this video on YouTube. And don't forget to hit the subscribe button so that you can be kept up to date for when these videos come out. Thanks for watching, and see you in the next video.